The presentation loaded. I just wanted to talk about, what occupational stress actually is. So occupational stress is our body's emotional and physical response to a mismatch in expectations between the job requirement and the working conditions, our qualifications. Yep. So chronically, occupational stress is referred to as burnout, right? How many of us have probably used that term, in the last month itself? Can we just have a show of hands through that? Right, I see a couple of hands going up. How many of us have possibly used that at some point in time in our life? Right, so burnout, and primarily for healthcare workers, results is multifactorial, and it stems from various reasons, right? They could be from some that we commonly understand as overload of work, time management at work, work conflict. The other factors that we subconsciously actually practice but don't really think that they contribute to a burnout would be gender discrimination at work, marital status discrimination at work. So the burnout prevalence in healthcare workers is somewhere between 27 to 87%, which is one of the highest across industries. According to a recent study by the World Health Organization, when interviewing 200,000 doctors, 42% of the doctors actually reported an instance of burnout in the last 6 months. 42% is almost at an epidemic level, right? So the need to address stress for healthcare workers is paramount, is now. And if we don't actually make it a top priority as hospital operators, as human resource managers working in the healthcare ecosystem, it can lead to a lot of substance abuse for our team members and colleagues. It can lead to absenteeism, and it can just lead to general disengagement from your work practices. So any questions around why we need to address burnout? Why is it important? I'm happy to take them now because, I'm not going to spend a lot of time on why is it important. I'd like to actually dive into what is it that we can do to address it and what are some good practices that we can actually adopt in order to enable that. So, I'll encourage you guys to use the mics in between if there are any questions around burnout and why is it important. Otherwise, I'm happy to get started with my presentation. It was a World Healthcare Organization. I can share it with you rightly after that. 200,000 doctors primarily. Yeah, the 42%. Yeah, every other doctor reported an instance of burnout in the last 6 months. And across healthcare workers is between 27 to 87%. Why I use such a broad range? Because it varies between nurses, general duty assistants, so on and so forth. So for doctors, I have the exact percentage. Yeah, and these are the reported numbers. So imagine the amount of unreported numbers, that would be there, because clearly the task at hand is very, very large. And that's why I didn't want to use the word epidemic, because it makes it sound like I'm really trying to seek attention and draw attention to it, but it is that grave, every other doctor. Yes, and this is something that I say at Sukoon a lot, and when I tell you guys a little bit about Sukoon, is that healthcare workers actually provide healthcare at the cost of their own mental health, right? And this is not something that they should be practicing. We should definitely have avenues for them in order to facilitate better emotional regulation. And if you were to ask business managers as to why is this important, the second highest cause of death in America is actually clinical errors, right? So if we can reduce their stress, if we can have a happier and a more productive workforce, we can possibly also have better patient outcomes. So when we actually talk to business owners and when we talk to managers and they're like, hey, why should I invest in getting a therapist for these guys? Why should I invest in psychiatric consults for my workforce? So these are some numbers that we can actually take to help encourage them, because if they're looking at an EBITDA and a profit margin, this will lead to that as well. Thank you so much for that question, by the way. Yes, please. It's basically essentially, a chronic manifestation of your physical and emotional response to your job dissatisfaction. When I say job dissatisfaction, it can be multiple levels, right? You can have a workplace conflict. You can have an overload of your workload. Time management, not being able.
how do you see, there is in the first
I'll leave that to a clinician to answer that for you.
why don't you bring a clinician then?
Yes. No, I think there are two clinicians speaking after me.
Oh, good.
Yes. Cool. So, what are the services? I mean, why should you even be listening to me, right? Like, am I equipped to be telling you good practices? So, I'll be talking about Sukoon Health a little bit and what is it that we do there. Then I'll dive into what are the great practices that we should be implementing, because I have implemented these in our hospitals. So, like I was telling you, Sukoon is a chain of psychiatric inpatient, alcohol and substance rehabilitation, and outpatient clinics. The services that we offer are acute psychiatric care, geriatric psychiatry, child and adolescent psychiatry, clinical psychology, alcohol and substance de-addiction, online therapy, and RTMS. RTMS is repetitive transcranial magnetic stimulation. It's a US FDA-approved intervention for treatment-resistant depression, anxiety, and OCD. Apart from this, we also do ECT, which is electroconvulsive therapy, something that you would have seen in the media as shock therapy, which is very wrongly and very poorly represented. So please don't go by that at all. The three formats of care that we offer at Sukoon is we have Sukoon Psychiatry Centers, where the patient profiles are primarily emergency and inpatient care for schizophrenia, bipolar, borderline personality disorders, and so on and so forth. The recovery centers, where we do alcohol and substance, de-addiction, and rehabilitation. The detoxification happens at the psychiatry centers, and then we move them to the rehabilitation center because the length of stay at the rehabilitation centers between 45 to 60 days. For low intervention and low severity, we've got Sukoon Centers for Mental Health, where we treat anxiety, OCD, depression through psychiatrists and clinical psychologists and RTMS. This is what the Sukoon Psychiatry Center in Gurugram looks like, the 21 single occupancy rooms. We believe in creating an environment that's conducive to recovery. So all rooms have access to natural light. There's a lot of greenery around. And we've actually worked with an architectural firm called HKS that is built across 50 behavioral institutes globally. This is the Sukoon Recovery Center in DLF Chhatarpur. Once you move to the rehab program, physical fitness, and a multidisciplinary team approach between psychiatric social workers, clinical psychologists, occupational therapists, counseling psychologists, that takes form. This is the Sukoon Psychiatry Center in Bangalore. We try to take a bigger and a better approach from what we learned before by including gymnasiums, art therapy studios, occupational activities for the patients actually admitted in our facilities. The Sukoon Center for Mental Health, as you can see, a therapy room. Every room in every center and every facility has access to greenery and plants. This is on a terrace, and we've still kind of built a perimeter around it to be able to offer that to our patients. We've also built an early intervention center inside Jindal Global University, which is the OP Jindal Global University in Sonipat, that caters to 12,000 students and 3,000 faculty members. The primary goal that we have committed to is self-harm incidents. Currently, they see close to 7 to 8 fatal self-harm incidents annually and about 30 self-harm incidents annually. We promised to get them to about 2 self-harm incidents or almost 0 by the end of next year. How we're tackling this is completely through awareness and early intervention. We need to identify the problem at its early stage. We need to tell people that it's okay to seek help. It's okay to come and meet our clinicians, and it's completely private and confidential. Now, getting into what good practices for healthcare workers, for their better mental health would look like. The first one that I'd like to put forth that everybody probably would be familiar with, and if they're not, I'm happy to take questions after this, is journaling. So journaling is just a regular exercise of writing down your thoughts, your emotions, your feelings, and your reflections. Right? So it helps workers process their emotions and experiences while fostering self-awareness and personal growth. Now, when most people are told to journal, the first question, and myself included, people ask is, where do I start? You know, what do you mean by write my thoughts? Do I go about writing my day? Is this a diary? So what really helps people is if we give them a prompt, right? So think of it as an activity where we're telling, suppose, 10 general duty assistants that please reflect on a challenging patient interaction today and what did you learn from it. Once we get them to actually start writing that down, right, we should collect what everybody is written down and actually move this almost to a peer support environment where we share with people as to what the difficult patient interaction was. Articulation of it in writing really helps process your emotions and take away any negative thoughts or any negative symptomology that could have happened due to a difficult patient interaction during the day. This is a personal recommendation which has worked at Sukoon, is we should ask them to submit it and we should recognize it across teams. So this is one of the prompts that I'm talking about, but if you guys are thinking about some other prompts as well, please do share, and I can help you understand as to why recognizing what they have written down from that will actually help them with it. Because it's not enough that they write it, we have to recognize it as well. Any questions around journaling? So what I've tried to do is basically pick very low-cost interventions so that management is not resistant to change, right? Journaling is as simple as giving them a piece of paper that has a bad printout on it, getting 10 people in a group and asking them to literally write their thoughts down. The second recommendation, right? A lot of work anxiety comes from a lack of understanding of what my manager wants from me, what my manager's manager wants from me, what are actually my key goals and responsibilities within the organization. At the time of joining, they'll give you a simple KRA list, but in a timely manner, what is it that I want to do for myself within the organization? How do I want to grow as a nurse? How do I want to grow as a doctor? How do I want to grow as a lab technician? So if we encourage managers to sit down in a timely, in a consistent, periodically with all the team members to help identify what a SMART goal can look like. So SMART stands for the goal needs to be specific, it needs to be measurable, it needs to be achievable, it needs to be relevant, and it needs to be time-bound. Right? So give you an example of how do you improve time management skills during night shifts. So as hospital managers or as healthcare workers, something that we constantly struggle with would be, hey, during the night shift, nursing is usually seen fall asleep, right? So you build this as a goal. You take it around it and say, how do we improve that time management? Could that time possibly be used for journaling? So just trying to integrate the two things with each other. During breaks, team members can reflect on their time management strategies and specific goals as a result of this to enhance their efficiency. The manager needs to keep checking in as to how can the manager support them in these SMART goals that they're setting for themselves. The third one, creative expression, right? Something that we all really understand and something that we practice. People say when you're overthinking, write. When you're underthinking, read about it. When you're feeling stressed, express yourself through an art form, right? It could be painting, it could be music, it could be pottery, any shape and form. The goal here is unfortunately repeated as the last one, that's a break, but just providing workers with a sketchbook, with a coloring book, with some art material in a dedicated space can really help them have some downtime during their breaks. Another way to inculcate this in the entire reward and recognition program is if we just collect stuff that they're doing, the sketches that they're making, the songs that they're writing, the videos that they're creating, and actually show them in a reward and recognition program that instills a sense of fulfillment in them. Any questions around creative expression or how to deploy it, or if you've already tried to do it and some factors that were actually resistant to it, I'm happy to answer those as well. Gotcha. I'll move on to the fourth one, right? Personal wellness breaks. I know we have tight schedules. There's always something going on around a healthcare facility, right? But we really need to teach them as to how to take personal wellness breaks, even if it means putting it down in their schedules, telling managers to do that as a group exercise. To give you an example of an activity which is a good personal break would be deep breathing exercises. It's called a 4-second inhale, a 4-second hold, and a 4-second exhale. It's a very grounding exercise. It really helps in just decluttering your thoughts and getting yourself back into an engaged and productive mode. Nurses and other healthcare workers can take a few minutes to practice a deep breathing exercise to relax and reduce stress levels during their shifts. We all know that stress, especially in emergency care and other inpatient care, runs really, really high. So deep breathing can very, very much help with that.
Can you repeat the 9 seconds that you will
4 seconds. 4 seconds inhale, 4 seconds hold. And, I'm not going to be presumptuous, but I get a feeling that you're a clinician, so please correct me if I'm wrong, because I'm the first one to raise my hand and say that I'm coming purely from an operator's lens. Okay, got it. Thank you so much. Yep, got it. Moving on to the next recommendation, right? You'd be surprised by how much people can actually help each other if we just give them a safe and a supportive environment to be able to talk about their experiences and their feelings. So peer support networks really help with that. Now, it's not as simple as putting 8 people in a room together and just telling them to talk about their feelings, because you'll be met with the same sort of questions as journaling. Hey, what do we talk about? Especially when you talk about men and putting 8 men in the room, they'll be like, hey, I'm not here to discuss my feelings. What really helps again is giving them a direction and helping them with a prompt. To give you an example of a prompt, like a group of healthcare workers, they'll form a peer support group and you'll ask them that, what was the last fatal incident within your department or within your organization, and how did that affect you? Is that something that you're carrying home? Is that something that you would actively like to talk about? You'll see the beauty of it. Once one person starts opening up, a lot of people will start sharing. They'll seek advice from one another. We just need to kind of capitalize on that and make a schedule out of it, right? But I would really encourage that please have a dedicated room for this. Give them some water, put some chairs around, have a timetable outside so that they see that they're not the only ones. Multiple departments, multiple stakeholders, multiple workers are participating in the same exercise. The same peer support network can again be used to recognize their journaling activities, their creative expression activities, or even their goal setting, and to share with one another as to where they are in their journey. This one is actually not low cost, but something that hospital and healthcare managers can implement very easily, because there's a lot of liaison psychiatry and a lot of liaison therapy and psychology already happening. We need to provide our workers with professional support. Something that we do at Sukoon is every Tuesday and Thursday, we've got 2 hours where any clinician, any nurse, any GDA can come and speak to any clinical psychologist or psychiatric social worker or counseling psychologist completely free of charge. It doesn't need to be through the management system. They can just approach the clinician directly and schedule it, because a lot of times people have privacy and confidentiality issues, right? Because there's so much taboo and stigma attached to seeking mental health care support that you want to remove that by making it completely anonymous and bridging the gap between the clinician and the healthcare worker. So it can be bi-monthly. We'll let you guys decide the frequency of that, but any shape or form of providing them psychiatrist and psychologist and therapist support would be very, very beneficial. The next one, right? Something that we hear a lot, that good physical health and good mental health go hand in hand. Good physical health actually leads to better concentration, to more alertness in your work environment. Now, how do you promote good physical health, right, in an organization? We can have our human resources actually make a physical activity calendar. Everybody's wearing wearables where you can track how many steps an individual is doing. We can organize a weekly running club for staff members so that it's a good social outlet, right? Not most social outings currently are anchored around dinners, alcohol, and partying, right? We need to kind of change that narrative. Like even in healthcare, when we talk about a continued medical education event, like a CME, we've all kind of been there and we've seen what goes down. So promoting physical activities as form of social outreach, as form of offsites and human resource activities would be very, very beneficial. We can also gamify this entire process. How do you increase participation? Because when you ask somebody at work, hey, do you want to join my running club? You would possibly, the first answer would be no. Do you want to join my rock climbing club? No. So we need to gamify it, right? Who's participating? How many times are they participating? What does that mean? At which level are they? What time are they completing a specific exercise in, so that they get motivated to get better at it and are not looking at it merely as an organizational exercise, but something for their personal development and growth as well. Self-care activities. So self-care can take various shape and forms. I'll give you an example of that. And we all practice it when it comes to grooming, right? Something as simple as taking the time to shave my beard, to trim my beard, to applying moisturizer on my face, cutting my nails. When I was talking to Dr. Mani very recently, and I was telling him that, I kind of wanted to fix grooming at a nursing level, because I don't think it's fair that somebody's doing an 8-hour shift, then they have to travel back home, and we're expecting a sort of a presentation. So he came up with a very simple idea. Why don't we just call a salon expert or a beautician to Sukoon once a week, and make it completely free of cost for everybody, so that whoever wants, they fill in the calendar in the morning. It's 15-minute slots for something as simple as, threading or a haircut or just a head massage, and people access that. So we've actually, every month, we give out coupons to our nurses, and those coupons basically indicate that once you go and you meet the beautician who's inside the hospital, you can access any and every service that they're providing. We have an almost 80% utilization rates of those coupons now. If that is, suppose, costly to the organization, just encouraging them to bring skincare products or providing them with some skincare products in the nursing changing rooms, in the nursing bathrooms, and allocating some time and space to that would really help with that as well. Just to summarize the activities that I spoke about: journaling, goal setting and self-reflection, creative expression, personal wellness breaks, peer support network, professional support via psychiatrists and clinical psychologists and therapists, regular physical activity, and self-care activities. Thank you so much for listening to me. Happy to answer any questions that you guys might have in the implementation of these practices, and I'll leave these on.
Hi, it was nice listening to you. Obviously, in all your hospitals, you must have implemented all of these, right?
Yes, we have, to some shape or form, not to the best where I would like them to be.
So I'm sure, because you are a very committed person, you will take note and try to encourage everybody to... Initially, they might have... What are the challenges that you face, even for a person like you who is so keen to and committed to do this? So I may do it for, suppose I'm a nurse, I may journal for a week maybe, and then just give it up.
Yep.
And creative expression, not everybody can do it, may not want to do it also. So all of this, some of this they'll be able to do some. So why don't you be your own devil's advocate and tell us the challenges that you faced and how are you trying to overcome that?
So earlier, like you rightly said, that getting them to do it in a regular fashion, to be consistent about it, because it's not a one-time activity. We actually made it a part of our reward and recognition program, something that we do at every hospital on a monthly basis, because we have an employee of the month, we have a team of the month, we have an extra mile award. On the basis of that now, because of journaling, we also have the sharing circle. So the awards only come at the very end. Every month from one facility, we have one person whose journaling exercise in the peer support group that was shared that people actually really benefited with. So once they seek that recognition, that it's only not for myself, my peers are also seeing this, the doctors are validating this, the business managers are validating this, they start doing this in a more timely fashion. For creative expression in the staff and the nursing areas, we actually pin up stuff that they put, and we ask them to vote on which one do they think they like the best. So our paintings go up, and the videos and the music forms are shared in WhatsApp support groups.
Oh, that's good.
So, when people actually see that their work is being shared, it's being appreciated, it's being recognized, they really start conforming to a consistent pattern. Something that I've still not been able to crack is have an all-male peer support group. I always need to have girls in the room. They start sharing first, and there's a lot more vulnerability, and then the men share. Something, if I'm being truly honest, that helps is, if I'm in the sharing circle and I share and I be honest with them, it really breaks barriers and boundaries. It's a for-profit setup, sir. It's a for-profit. So it's an all-inclusive price for 20,000 rupees a night, but it has your entire multidisciplinary team included in it. Psychiatry-led. Yeah, so there's Dr. Satish Ramaya, who used to head Marga before. He's the executive director for my psychiatry services, and Dr. Vipul Rastogi. And under them, they've got a team of clinical psychologists, counseling, occupational, psychiatric social workers, physiotherapists, yoga instructors, art-based therapists. So yeah, it's about 6.5 hours of clinician face time a day per patient.
we'll definitely have a panel discussion once the sessions are all over. So maybe if you have more questions, please, consolidate them and, journal it. Make a note and you can shoot your questions once all the speaker sessions are done. Thank you so much, Mr. Kanishk, for
Thank
such
you
a
so much,
wonderful
everybody. Really
session.
appreciate it. Bye-bye.
Thank you.